vital signs? Vital signs are those important components that you need Why are you guys writing? I sent the notes already, right?
Yes.
You can only jot some of those important things that I will say that are definitely in your note, but you need for them to stand out. Vital signs are those important components that will let you understand that this particular individual is healthy or is sick, is in a situation of a crisis, or is in a chronic situation, because when we are talking about acute illnesses or we are talking about chronic situations, those are two different stages. If I'm having a high blood pressure simply because I am a hypertensive patient, it will be different from me having a high blood pressure because I just got myself into an accident. One is an emergency situation and the other one is a situation that has been there. It's not going to be as critical as another. And when you take a patient, or when a patient comes to the hospital in a situation of an emergency, maybe they are in a coma or a semi-coma situation or unconscious, their vital signs will lead you to interventions. This is now you seeing a patient that cannot tell you what they are suffering from, that cannot tell you where they feel pain, that cannot tell you the reason for which they are in that state. So it is only their vital signs that is going to help you to start working with the patient. And then they will now, after recovery, are going to tell you what is wrong with them, or how it happened, or how it started. Is that understood? So your vital signs stand to be the first component of a nurse. When you receive a patient in the hospital, the first thing we do is do what? Is check their vital sign. What is their blood pressure? What is their pulse? What is the temperature? What is the blood sugar level? What is their state of consciousness? What is the oxygen saturation? When you are certain that all these things have been put together, then you can go ahead to either give normal saline, ringers, glucose, or you are simply just going to allow the patient rest in case there is, or oxygen, or allow the patient rest in case there is no emergency situation in the coma. Somebody might come in a state of consciousness and you cannot find them having any high blood or low blood pressure. They are not having any high or low temperature. They are completely fine per parameters. There is no bleeding. In this situation, what do you need to do? You just put the person in a guard vein and then you send them now to the lab. The lab can commence. Let's see what maybe something is wrong somewhere. But if not, you cannot rush to start adjusting things because there is nothing to be adjusted. Now, please list me the few parameters that you know for vital signs. I hope you came with your BP machines.
Yes, madam.
Yes. What are the signs? What are you going to be checking? What are the parameters you are going to be checking? Temperature. Blood pressure, yes.
Oxygen
The
saturation.
pulse, yes. Respiratory rate.
Oxygen saturation.
Oxygen saturation. The patient's weight, yes.
Even the age, madam.
Alright, the age is one of the parameters you are going to take, but it's not going to be a parameter that you need to check at that moment. The LMP will be one of the things you are going to check. So now there is a difference between your vital signs that you are monitoring and taking information from the patient and taking a history of the patient. That will be under the history of the patient, but not under the parameters that you need to check at that moment. You need to check the patient's temperature, you need to check their blood pressure, you need to check their respiratory rate, you need to check the oxygen saturation, you need to check their glucose level, you need to check their pulse. That is what you need to check at that moment, because those are the things that if one of them is not in place, it might lead to you losing the patient. Now, knowing the last time the patient had her menses is one of the history you are going to collect. Now, this will be under you trying to understand what further could be the problem. Is that understanding? Knowing the person's age is one of the history you are going to collect. That is something else. Is that understood? So for the person that said temperature, what is the purpose? Why do we want to know the temperature of a patient? Yes? You said temperature, so you should answer the question. What is the indication for temperature?
To know if the person has a normal temperature rate, if it's above.
The LMP will be one of the things you are going to check. So now there is a difference between your vital signs that you are monitoring and taking information from the patient and taking a history of the patient. That will be under the history of the patient, but not under the parameters that you need to check at that moment. You need to check the patient's temperature, you need to check their blood pressure, you need to check their respiratory rate, you need to check the oxygen saturation, you need to check their glucose level, you need to check their pulse. That is what you need to check at that moment, because those are the things that if one of them is not in place, it might lead to you losing the patient. Now, knowing the last time the patient had her menses is one of the history you are going to collect. Now, this will be under you trying to understand what further could be the problem. Is that understanding? Knowing the person's age is one of the history you are going to collect. That is something else. Is that understood? So for the person that said temperature, what is the purpose? Why do we want to know the temperature of a patient? Yes? You said temperature, so you should answer the question. What is the indication for temperature?
To know if the person has a normal temperature rate, if it's above, it indicates the person is likely going to enter convulsion if not attended to very fast.
Alright, you answer the question, but you don't answer the question at the same time. The indication for temperature is to indicate the body balance, how hot or how cold the body is. Remember that when we want to ascertain that somebody is actually dead, it will show by the coolness of that individual. So when they bring in a patient in the hospital, the reader says 0, if it does not read at all, that simply means the individual is not alive. So all your parameters can help you dictate whether or not an individual is in perfect health, whether or not an individual is sick, whether or not an individual is alive or dead. You simply need to know what to do, where and when. What is the importance of vital signs? So we have indicated that the vital signs to be monitored, we have temperature, we have the pulse, we have the respiratory rate, we have the blood pressure, we have oxygen pain level, and we have oxygen saturation. We might not do all of this every person, because you do them depending on the type of individual that you are having in front of you and they are presenting complaint. However, these are the important factors you must monitor at each intervals depending on the patient's condition. Yes, what is the importance of vital signs? Yes, I should be seeing hands up. Importance of vital signs. Yes, one.
Vital signs help us to detect the present physical state of the patient, whether the patient is healthy, dying, or needs immediate attention.
Thank you. Vital sign helps us monitor the individual's state at that moment. So if it is your first contact in the hospital, they will know whether you're healthy or you're sick from your vitals. 2. Vital signs help in assessing the response to treatment. That simply means that if you had a patient that is having a temperature of 40 or above, After they have given the treatment, they should recheck. And when we recheck, maybe within a period of 3 to 4 hours, and your temperature is still at 40, it simply means that the treatment was not effective. Or it simply means that there is another positive agent from what we are trying to treat. So we will keep monitoring and seeing how the temperature is evolving. Is it now balanced? Is it still high? And to see whether or not we are going to change the treatment that you are taking. Is that understood? Again, vital signs help in what? In early detection of health issues. For those that will be suffering from diabetes or hypertension, if you easily go to the hospital, they might notice that your blood sugar level is always high. And then they will intervene by either directing you on healthy dieting, or they will intervene by telling you how to manage your stress and how to live forward. Is that understood? It equally helps to create a baseline data, baseline assessment, especially for the mothers that are doing antenatal. When you are doing baseline assessment, to understand if the woman is having diabetes in pregnancy or hypertension in pregnancy, will only be detected if you conducted a perfect baseline data at 12 weeks. Okay? Because we are going to be comparing each and every other data from that first data. So when a woman comes and is for booking clinic, you need to make sure that you take each and every information from this woman. If not, you are going to answer for when the time comes and she's in preeclampsia. Alright, this person is already cold. The person is gone. When there is no blood flow into your system, what should your system be warm for? Alright, the coldness is not as a result of maybe the cold out there, but the coldness of a dead body is evident. You can't, it comes with a certain feeling, with other signs and symptoms, and with other evidence that indicates that the person is gone, as well as how hot the individual is. If a baby comes with a temperature of 40, what do you do? If a person is with a temperature of 40 something, what do you do? If the temperature is 38, 39, what do you do? If it cannot be detected at all, what does that indicate? So these are the parameters that we are talking about. We come to the pulse, the heart rate. What is pulse? I want a definition of it. What is it measured? Measurement of pulse. Sorry? Don't whisper, just tell me. At this level, you guys should not be keeping quiet.
And the number of times your heart beats.
Yes. The rate at which the heart beats per minute. That is your pulse. So you need to check if the individual is having palpitation, it will indicate. Because it's going to be abnormally high. And if the individual is unresponsive, it's going to indicate that there is no pulse identified. So you will know that there's a problem with the heartbeat. The individual might not have any sensation or anything. The heart might have stopped. Then you need to start working on it. You need to start your CPR immediately. If you see an accident scene, what is the first thing you're going to check? When you check at the environment that is safe for you to step in, because you don't just get into an accident scene, you first of all make sure that the accident scene is safe. We can't have 3 dead bodies on the ground adding with another foolishness. You need to be sure that you are safe. You are the first person to be safe in that environment. So if the environment is safe, you step in. And the first thing you do is you call the individual. Sir, when you call the individual, you should be able to Tap them. Are you okay? Now when you tap them, you don't just tap on one soldier, you tap on both soldiers. Because in case the person has gone into a stroke, if the person has a stroke on one side, if you tap it, the person definitely not going to feel it, right? But if you tap on the both sides, the person might feel on the side that is still active and sensitive. When you call upon the individual, you're going to have either a response or no response. And the next thing you check is the person's pulse to identify if the heart is still beating. If the heart is not beating, you start your CPR immediately. Is that okay? After checking for the safety of an environment and realizing that the individual is still breathing, what is the next thing you should do? As a healthcare personnel, as a good Samaritan, as an individual, a community person, what do? You call for backup. Because you are trying to save the person's life, right? If you wake that person up or you are trying to put the person in a state of stability, what do? You need to send the person to the hospital. How will you send the person to the hospital if you do not call for backup? You need to call for backup. You need to ask for help. Help! Call for the emergency ambulance. Call for a car so that we can take the person to the hospital. So you need to understand your CPR. Not everybody is going to be lucky to be asked to do bed making. Hypotension. That is the person you need to be running behind. It means the individual is on the verge of moving on the other side of life. Okay, so we need to serve the individual with normal saline. That is because it contains sodium, and sodium will help the uptake of water instead of releasing it, and it will increase the blood volume, which will further increase the blood pressure. If not, when it comes to high blood pressure, you don't necessarily have to intervene, except you counsel the patient as a nurse. You counsel the patient, you keep the patient for some time to rest before you do the re-examination of the blood pressure or re-monitoring of the blood pressure, and equally you indicate to the doctor about the increase in blood pressure, and then they will see how they are going to manage it in the situation whereby the individual first suffers from hypertension. If not, you just need to allow the person to rest. It might be a triggering factor. Maybe the lady just from the house quarreling with the husband, they have had a fight for like 3 days. Is that understood? Now we talk about pain level. Pain level is very important when it comes to your parameters and the hospital. This is because if an individual is suffering, they are Muslims and they are Christians, and Muslims cannot express pain. To them, it's a weakness. So she will be in severe pains, but she's not going to cry out. So imagine somebody is having a ruptured appendix or an ectopic pregnancy and is in severe pains, and the person just like this. Mama, how are you? She said, I'm fine. I just have a little bit of pain. That's how they keep saying it. Even if they are in labor and they are almost 10, you just meet them making. If you joke with them, they will deliver on the floor. So when a Muslim woman is in the hospital, you start examining her as frequent as possible, because she's not going to tell you when it's worse. You will not know anything. To her, it's going to be the initial state of labor. Is that understood? So you need to check. So when the person is under pain, you always ask the individual, Mama, between a period of 1 to 10, what do you feel? Is your pain at 1, or is your pain at 10, or is between 7, 8, and 10? You see, she can easily tell you that at the moment my pain should be at 8.5. That simply means the individual is in severe pains. You should start trying to monitor, especially when it comes to headache, When somebody is saying that I have severe pains in the head, try to ask the individual, what is the rate of the pain? Because you see somebody that will be shouting and shouting and the pain is at 2. And then you meet another individual that will not say anything and the person is at 10. So to you are going to give painkiller to this person and this person is almost dead and the person is not going to have painkillers. Is that understood? Yes. When somebody comes to the hospital because of an accident, you need to be sure. What is the pain level? Maybe there's a dislocation, a hip dislocation. You will not see any blood, you will not see any fracture. What is the level of your pain? And they'll tell you the level of the pain is 200. And then you know how to manage it. Oxygen saturation. What is the purpose of oxygen saturation? The next is oxygen saturation. I'm listening. What is the purpose of oxygen saturation? Say it. I'm not hearing what you're saying. Stand up. Speak. Speak, hello.
To measure the percentage of hemoglobin in the blood.
Yes, you're right. So why were you not wanting to talk? It measures the percentage of hemoglobin in blood that is saturated with oxygen. So from 95% or higher, that simply means that the person's hemoglobin is highly saturated with oxygen. On the other hand, if the oxygen saturation starts dropping right up to 50 and 10 sugar level.
Early in the morning before.
Yes, and what are the values? What are the values differences? How do you know which one is right, before or after? Before. I said, what are the values that makes you know that it's right? Because you can take before, or you can take after, or you can take an hour after meal. Alright? You can check it for fasting blood sugar. You can check random blood sugar. That simply means the person had eaten at some point in time. Or even if the person had not yet eaten, but it has been a long time from the morning period. So if I'm going to check my sugar level now, I have not eaten since morning. Do you think it's still going to be fasting blood sugar? I am functionally working from the energy that has been stored. So now my glycogen has been converted like 50 times to energy. So my bloodstream is having energy. Okay? That is why they said early morning. The fasting one is early morning when you were on complete rest and you have not done anything, you check it. It's fasting blood sugar. When it's already been the day, your glycogen has been converted to sugar and distributed into your bloodstreams. You have not yet eaten by mouth, but your system has eaten. Is that understood? Or it could equally be fasting blood sugar as a result of the fact that you had already eaten. And another way, when they are testing for somebody that is having type 1 diabetes, they will check your blood sugar 1 hour after meal. But then the only difference is going to be how do you identify which is which? Which level is high? Which level is low? If you had eaten, how do we identify what is high? How do we identify what is low? That was my question when I got into the maternity, when I was doing my exams. When you go to the maternity, I was asked which level of glycemia is high or low in a pregnant woman. How do you diagnose it? So you will need to give all the explanations. That was the only question they asked me. I did nothing. They just called me and I explained it. And when I was done, I went out and I had 16 in maternity. They're always very stingy with practical marks. so make sure that you outsmart them. It's not like defense, they give you marks anyhow. Practicals, before one person gives you marks, it's like you should go and call your ancestors. So what is the difference between them? What is the range for the fasting blood sugar? Don't murmur. What is the range? The range for fasting blood sugar is 80 something, let's say 86, right up to 125. Right up to 185. But for random blood sugar, it can go right up to 140. But if you are taking random blood sugar and it is more than 140, you need to ask the person if the person drank a lot of juice that day to be able to go that high. If not, you need to tell the person who will check it for some days to confirm that you are not having a diabetic problem. What is diabetes? Which metabolic disorder is that? Sorry?